Priscilla Biya and her family live in Janta Adamu, a community in Jos that is surrounded by rocks and mountains. She says accessing clean water is a challenge, especially during the dry season.
We've never had it good in this community in terms of water, especially for drinking and cooking. Many times in the past, we've had to store water during the rainy season to use in the dry season. It's that bad.
The rocky nature of the area makes it difficult to sink wells or drill boreholes. Most members of the community rely on a stream that runs from the mountain tops during the rainy season for their water needs. But the water isn't clean enough and has led to disease outbreaks. Health practitioners say more than 950 cases of cholera were recorded in the state last year.
We've seen a lot of outbreaks of infectious diseases that are related to poor water provision or waterborne diseases. One is cholera that we've seen over the past 3 years. Almost every year within the last 3 years, we've had like cases of outbreaks of cholera in Plateau State and also in other parts of the north, which is closely related to the water supply that we have.
The Plateau State government says more than 14 people have died of cholera in the last 2 months. Members of this community are calling on the government to ensure adequate water supply in the region.
It is not a pleasant situation at all. Our children have been the ones more at the receiving end. We urgently need government's intervention with regards to potable water in this community.
The state government has earmarked $18 million to expand water supplies in the state. It says it is for the construction of additional water reservoirs, overhauling of old water pipes, and laying of new ones in communities battling water challenges in the state. Members of this community like Priscilla Biya are hopeful that these efforts by the government will improve access to safe but also sufficient water supply in the near future.